Hello guys, welcome back to another video of respiratory system, and we'll be talking about asthma in today's topic. Now, what is this asthma? This asthma, it is an obstructive lung disease. It is a type of obstructive lung disease and it occurs due to increased intrathoracic obstruction. It occurs basically due to increased intrathoracic obstruction and it is a reversible condition. It is perfectly reversible if properly managed. Now, this asthma again, it is a chronic condition. It doesn't develop overnight. It is a chronic condition which can affect anyone of all age groups. It can occur in anyone, irrespective of the age groups. Now, how is it caused? Like, what actually occurs in asthma? In asthma, we basically have inflammation. We have inflammation and we have muscle tightening around the airways, which makes it difficult for the person to breathe. The person is not able to breathe properly. The person has shortness of breath and asthma. So, what are basically the types of asthma now? Now, first of all, before going deeper into this topic, I'd like to discuss one thing over here. I had previously briefly explained about obstructive and restrictive lung disease in my earlier video, and I would like you to know that in obstructive lung disease, I told you earlier that we have decreased FEV1. In obstructive lung disease, FEV1 is less. Now, what was actually FEV1? FEV1 was forced expiratory volume. It was actually a component of timed vital capacity and the first the amount of air which came out in first second was actually FEV1. And I told you earlier that in obstructive lung disease we have a decreased FEV1, that is we have a value of FEV1 that is less than 80%, or you can say it less than 0.8. So in all obstructive lung disease, we have a decreased FEV1 less than 80. So even in asthma, the patient will have a decreased FEV1. So what should we do if we do a spirometry and we get a decreased FEV1 and we suspect that the patient is suffering from asthma? We have to first give beta agonist to the patient. We have to give beta agonist to the patient, which is basically salbutamol. Now, what does this salbutamol do? Salbutamol is basically a bronchodilator, and we have to give this salbutamol in inhalation route. Now, if we give this beta 2 agonist salbutamol inhalation to a person with asthma, whom we suspect is having asthma, obviously, if the condition improves, if there is good response, if there is good response, then you can say, or if you find reduced wheezing, if you find reduced wheezing over there, so this will be called as reversible obstruction. This will be called as reversible obstruction, and this will be an example of asthma. So here, if if you suspect obstructive lung disease in any patient and you give beta 2 agonist to the particular person and you get a good response, that is, you have decreased wheezing. So this will be called as obstructive reversible obstruction, and you can suspect asthma in this patient. Now, if on the other hand, if the response is poor, if wheezing is not decreased, then it will be called as irreversible obstruction. It will be called as irreversible obstruction. And for example, COPD. Again, in COPD, we have two types. We have chronic bronchitis and we have emphysema. The patient of emphysema, we call them as pink puffers. We call them as pink puffers. And in chronic bronchitis, we call the patients as blue bloaters. So this is basically a criteria which can help you know, which can help you diagnose bronchial asthma or COPD. You can differentiate these two conditions based on this. I'll explain it again in Hindi that सपोज आपको चेक करना है कि किसी को अस्थमा है या फिर किसी को सीओपीडी है और आपने ये सस्पेक्ट किया कि किसी को अस्थमा हो सकता है तो आप सबसे पहले क्या करेंगे आपने उसको स्पायरोमेट्री करा और वहां आपने देखा कि उसका FeV1 जो था दैट वाज लेस देन 80 तो आपने उसको एक बीटा बीटा टू एगोनिस्ट दिया दैट इज साल्बुटामोल इनहेलेशन आपने उसको दिया व्हिच इज एक्चुअली ब्रोंकोडायलेटर और उसका रिस्पॉन्स गुड था मतलब वीजिंग रिड्यूस्ड थे व्हाट इज वीजिंग वीजिंग नॉर्मली हम अस्थमा के लोगों में वी कैन हियर अ रेस्पिरेटरी साउंड कॉल्ड एज वीजिंग इन अस्थमा पेशेंट्स नाउ दिस कंडीशन इट कैन बी कॉल्ड एज रिवर्सिबल ऑब्स्ट्रक्शन seen in asthma और अगर उसका रिस्पॉन्स सही नहीं हुआ if the response is poor then it will be called as irreversible obstruction which can be basically seen in COPD में देखने को मिलेगा और हमको पता है कि COPD में दो टाइप के होते हैं बेसिकली we have chronic bronchitis and emphysema के पेशेंट्स को we call them as pink puffers and chronic bronchitis के पेशेंट्स को we call them as blue bloaters. We'll discuss about COPD in the next video. We'll discuss bronchitis and emphysema separately. So you will be able to understand why am I calling these patients as blue bloaters and pink puffers. I'll explain it separately. But today we'll focus only about asthma. Now, asthma itself is a very big topic. So I won't be discussing about the management of asthma. As for now, we'll be discussing about the investigations, about the clinical findings, histopathological findings, pathophysiology types of asthma, but we'll discuss about management in the next video. So let us start with types of asthma. Now, this asthma is basically of two types. We have intrinsic asthma and we have extrinsic asthma. Now, this intrinsic asthma here is not most common. Extrinsic one is most common. So, what are the trigger factors? What are the trigger factors of intrinsic asthma? Intrinsic asthma is basically non-allergic. It basically occurs in adults, and the trigger factors are cold, exercise, drugs, and infections. So, intrinsic asthma is non-allergic, basically seen in adults. Trigger factors are cold, exercise, drugs, and infections. Now, which drugs? You might have heard about aspirin-induced asthma. And the extrinsic asthma, on the other hand, this is an allergic condition. That is, it is IgE mediated. It is IgE mediated. We have basically type 1 hypersensitivity reaction over here, and it is most commonly seen in children. And the trigger factors, they are basically allergens. They can be any sort of allergens, but mostly we talk about pollen over here. Let the pollen be an example of the trigger factor for extrinsic asthma. Okay, so let's talk about the pathophysiology of asthma. We'll basically talk about extrinsic asthma because this is most common. So how is it basically caused? Asthma, it is a type 1 hypersensitivity reaction and which causes hyperresponsive, which is caused due to hyperreactive antigens. So the most common allergen is pollen grains, which binds to the IgE antibody on the mast cells and causes the release of histamine and leukotrienes. Now, which leukotrienes are released? We have C4, D4, and E4. These three leukotrienes are responsible But what does B4 do? B4 का यहाँ पे इसके पैथोफिजियोलॉजी में कोई काम नहीं होता। B4 का काम होता है कीमोटैक्सिस। अब ये तीन ल्यूकोट्राइन्स और हिस्टामिन ये कॉज करते हैं ब्रोंकोकंस्ट्रिक्शन। दे कॉज एयरवे ऑब्स्ट्रक्शन लीडिंग टू wheezing और कफ। और इनके साथ साथ हम हमें इंक्रीज सेक्रेशंस होते हैं। देयर इज increased mucus production and an increased eosinophilic count. So this was all about the pathophysiology. We'll we'll go to the histopathological findings now. So what are the histopathological findings? Here I have posted an image of the histopath findings and I'll be explaining you through this image. So if you notice this green arrow over here, this green arrow, it shows goblet cell hyperplasia. This green arrow shows goblet cell hyperplasia. Then we have then we have a blue then we have a blue arrow which shows smooth muscle hypertrophy. Then we have basement membrane thickening. And then we have eosinophilic infiltration. So you can see over here, you can see goblet cell hyperplasia over here. You can see goblet cell hyperplasia over here. And you can find basement membrane thickening. You can see how thick this basement membrane has actually got. This is basement membrane thickening over here, this thing. And then you can find eosinophilic infiltration. These are here, these are the eosinophilic infiltration. And at last, we have smooth muscle hypertrophy. You can find the hypertrophy of smooth muscle over here. Hypertrophy of smooth muscles. So these four are the histopathological findings.